Somewhere in the last few years, you probably saw a commercial. Maybe it was on daytime television. Maybe it was a mailer that arrived in your mailbox. A friendly voice, an 800 number on the screen, and a promise that felt almost too good to be true. Switch to this Medicare Advantage plan and pay $0 a month in premiums. Zero. Call now. And the thing is, a lot of people called. More than 34 million seniors are currently enrolled in Medicare Advantage plans. That is more than half of everyone on Medicare. And a meaningful number of them are going to discover, usually at the worst possible moment, that the plan they switched to is costing them far more than the zero premium they were promised. Not because they were careless, because three things were not in that commercial and nobody explained them before the enrollment window closed. Today, I am going to tell you exactly what those three things are, and I am going to tell you about the one consequence of switching to Medicare Advantage that most people never find out about until they are already seriously ill and it is too late to undo it. Stay with me through all of it, because the last thing I cover is the one that can permanently change your financial exposure in retirement, and it is the one the insurance companies are absolutely not going to explain during open enrollment. Before we get into it, if you are not subscribed to Alana for Seniors, please do that right now and turn on the bell. Medicare rules change every single year. Benefits get cut, plans exit markets, networks shrink. What was true about your plan in October may be different by February. I cover those changes in plain language specifically for the people they affect before the enrollment window closes and the decision becomes irreversible. The people subscribed here find out in time. The ones who aren't tend to find out after. Hit subscribe, turn on the bell, and let's get into this. The first thing that was not in that commercial is the actual monthly cost. The Medicare Advantage plan advertised to you as having a $0 premium does in fact charge you $0 in plan premium on top of what you already pay. But what you already pay is not zero. Every single person on Medicare, regardless of whether they choose Original Medicare or a Medicare Advantage plan, pays the standard Medicare Part B premium every month. In 2026, that premium is $202.90 per month. It comes directly out of your Social Security check. It does not disappear when you switch to a Medicare Advantage plan. It continues every month automatically, whether you are on a $0 Advantage plan or not. So when the commercial says $0 premium, it means the insurance company is not charging you an additional monthly fee on top of the $200 and $2.90 you are already paying to Medicare. Your total monthly Medicare cost is not zero. It is $200 and $2.90 plus whatever the plan charges, plus whatever you pay out of pocket when you actually use the plan. And here is where the out-of-pocket piece becomes important. Medicare Advantage plans have something called a maximum out-of-pocket limit. It sounds like protection. In 2026, that limit can be as high as $9,250 for in-network services alone. For combined in-network and out-of-network services, it can reach $14,750. That means in a single year, if you have a serious illness, a hospitalization, or a course of treatment that requires multiple specialist visits, you could be responsible for up to $9,250 in costs before the plan covers everything. Original Medicare does not have this out-of-pocket maximum, which is a real vulnerability of Original Medicare. But most people who choose Original Medicare pair it with a Medigap supplemental policy, which picks up the costs that Medicare leaves behind. With Original Medicare and a Medigap Plan G, your annual financial exposure is essentially capped at the Part B deductible, which is $283 in 2026. That is the difference between being exposed to $9,250 in a difficult year and being exposed to $283. The second thing that was not in the commercial is the prior authorization process. When you are on Original Medicare, your doctor orders a test, a procedure, or a specialist visit. You schedule it. You go. Medicare covers its portion. That is roughly how it works. When you are on a Medicare Advantage plan, your doctor orders that same test or procedure. The plan may require your doctor to submit a prior authorization request first, asking the insurance company's permission before you receive the care. The insurance company reviews the request and approves or denies it. According to a 2022 report from the Department of Health and Human Services, 13% of prior authorization requests in Medicare Advantage plans were denied, even though they met Medicare's own coverage rules. 13%. And of the payment denials for services that had already been provided to patients, 18% were overturned when the patient or doctor challenged them, which means they were wrong denials that were only corrected because someone fought back. What happens during a denial is that your care gets delayed. You wait. Your doctor's office submits an appeal. You wait more. Sometimes the treatment you need is time sensitive. Sometimes the delay affects outcomes. And sometimes you end up paying for the care out of pocket because you cannot wait any longer. This is documented. It is not a rare exception. And it is one of the primary reasons that, in 2026, Medicare Advantage enrollment declined for the first time in nearly 2 decades. Seniors are leaving, but many of them are discovering that leaving is not as simple as they thought. Which brings me to the third thing. The third thing that was not in the commercial is what happens to you when you get seriously ill and try to switch back. When you first became eligible for Medicare at 65, you had a one-time 6-month window to purchase a Medigap supplemental policy without any health screening, no medical questions, no underwriting. Any insurance company was required to sell you any Medigap plan you wanted, regardless of your health history or pre-existing conditions. That window opened when you enrolled in Medicare Part B and closed 6 months later. After that window closed, the rules changed. If you want to switch from Medicare Advantage back to original Medicare and then purchase a Medigap policy, insurance companies in most states are now legally allowed to review your health history and deny you coverage based on what they find. They can reject your application because you have diabetes, because you had cancer, because you have heart disease, because of a chronic condition you have been managing for years. They can charge you significantly higher premiums. They can impose waiting periods for coverage of pre-existing conditions. The Center for Medicare Advocacy put it plainly in early 2026. Someone who has been in a Medicare Advantage plan for several years and then wants to switch to original Medicare may find they cannot switch and also get a Medigap plan. This is what advocates call the Medigap trap, and it turns what seemed like a flexible, low-cost choice into something much harder to undo. Here is how this plays out in real life. A woman we will call Carol enrolled in a Medicare Advantage plan when she was 67. The premiums were low, the dental and vision extras seemed appealing, and her primary care doctor was in the network. For a few years, everything was fine. Then Carol was diagnosed with a serious illness that required multiple specialist visits, imaging, and a course of treatment that the plan required prior authorization for. Several authorizations were delayed. One was denied outright. Carol spent weeks on the phone between her doctor's office and the insurance company. Meanwhile, her out-of-pocket costs were climbing toward the plan's maximum. When the treatment was behind her, Carol decided she wanted the freedom of original Medicare. She called and began the process of switching back, and then she applied for Medigap coverage, and she was denied because her health history now included a serious illness, and the insurance company in her state was legally permitted to use that information to turn her down. Carol switched back to original Medicare successfully, but without Medigap, she now faces unlimited out-of-pocket exposure every year for the rest of her life. The protection she wanted, the one that would have been available to her at 65 with no questions asked, was no longer available because her health had changed and the window had closed. This is not a rare story. The Medicare Rights Center and the Center for American Progress both issued warnings about this situation in 2026. And it is happening to more people because more people are leaving Medicare Advantage plans, often after discovering that the care they needed was harder to access than they expected. So what do you do with this information? Here are 3 things that matter right now, before this year's open enrollment. First, locate your annual notice of change. If you are currently on a Medicare Advantage plan, your insurance company was required to mail you an annual notice of change in September. That document lists every change to your plan effective January 1st of next year. Changes to your premium, changes to your copays, changes to which drugs are covered and at what tier, changes to which doctors and hospitals are in your network. Read it. Do not set it aside. Because in 2026, nearly 3 million Medicare Advantage enrollees were forced to find new coverage after major insurers exited their markets entirely. 7 million lost extra benefits they had been counting on. If your plan changed significantly, or if your doctor is no longer in the network, that is information you need before the enrollment window closes, not after. Second, use the free comparison tool at medicare.gov during open enrollment. The annual enrollment period runs from October 15th through December 7th. During that window, you can compare plans, check whether your specific doctors and drugs are covered, and make changes that take effect January 1st. The tool is free. You do not have to use it through an insurance broker who has a financial interest in what you choose. Third, call SHIP before you make any switch. SHIP stands for State Health Insurance Assistance Program. It is a federally funded program that provides free, unbiased, one-on-one counseling to Medicare beneficiaries. SHIP counselors do not sell plans. They do not earn commissions. They help you understand your options, identify your Medigap rights, and make a decision that reflects your actual situation rather than a TV commercial's version of it. To find your state's SHIP program, call 1-800-MEDICARE, which is 1-800-633-4227, or go to medicare.gov and search for SHIP. The consultation is free, and if you are considering switching between Original Medicare and Medicare Advantage, or if your current plan changed significantly, this conversation is one of the most valuable things you can do before December 7th. One more thing specifically for people who are currently in their first year of Medicare Advantage. If you joined Medicare Advantage when you first became eligible and it has been less than 12 months, you have what is called a trial right. That trial right guarantees you can switch back to Original Medicare and purchase a Medigap policy without medical underwriting, no health questions, no denial. But this window closes on the anniversary of your enrollment. If you are approaching that date and you have concerns about your plan, do not wait. Let me put the stakes on this as plainly as I can. The choice between Medicare Advantage and Original Medicare is not just a coverage decision. It is a decision that can affect whether you have Medigap protection available to you for the rest of your life. If you make the switch to Medicare Advantage and later need comprehensive coverage because your health has changed, the path back may be blocked by an insurance company that is legally allowed to say no. The commercials do not say that. The brokers who earn commissions for each enrollment do not say that. The mailers do not say that. Open enrollment is the one moment each year when you can review this decision with all the information in front of you. Do not let it pass without looking at your annual notice of change, comparing your options at medicare.gov, and calling SHIP if you have any questions about what your rights actually are. If you know someone who is on Medicare Advantage or who has been watching those zero premium commercials and is thinking about switching, please share this video with them now. One conversation before December 7th is worth far more than trying to undo a coverage decision after a diagnosis has already made Medigap unavailable. Subscribe to Alana for seniors, turn on notifications, and I will see you in the next one.